Welcome to another episode of Well-Adjusted Mama. I'm your host, Dr. Laura Brayton, and today's guest is Heidi Brockmyre, and we're speaking on Chinese medicine perspective on women's health and fertility. Heidi Brockmyre is a doctor of Chinese medicine. She has a decade of experience helping women grow their families. She supported hundreds of women in her clinic in San Diego and thousands of women around the world. She teaches women how to get pregnant a faster, healthier, easier, and more affordable way with her online program, Fertility Activation Method. She loves teaching women how to renew faith in their ability to conceive and to take back control of their health and bodies. Hi, Heidi. Welcome to the show. Excited to have you on today.
Hey, Laura. Thanks for having me. I'm excited to be here.
Yeah, so it's going to be an exciting topic that we're going to speak on today. Your expertise is Chinese medicine as an acupuncturist, and you've spent years and years working on improving women's health and specifically fertility using Chinese medicine. So Chinese medicine is very much in alignment with the chiropractic philosophy. And so I think this is going to be a really fascinating dialogue, and I'm excited to learn some new things today.
Awesome. I'm excited too.
Yeah. So let's start off with just sharing with the audience a little bit about who you are and how you got into this this area of your passion, essentially, for helping women's health and fertility.
Sure. So when I was going to school for Chinese medicine and acupuncture, I definitely loved the fact that Chinese medicine was so effective at helping women's health issues. I have firsthand experience with that. My cycle was irregular. I had a lot of PMS symptoms. I had uncomfortable periods. And I remember the first time I gave myself an acupuncture treatment, and, I did some research on good points to use, and I put the needles in, and I was I had back cramps. I was cranky. I just felt, period miserable. And within 20 minutes, my cramps were gone, my headache was gone, and I felt like so serene and I was like a completely different person. And I was just so blown away by it. And I thought, oh my God, why is this not the first place that we're told to go as girls and women growing up when we have these issues? It's so effective. And, I know I have been frustrated, and so many of my friends have felt frustrated going to their gynecologist for whatever issue. And that the only answer that they have is birth control, besides for the use of birth control. So I definitely felt drawn to specializing in women's health, or definitely having a strong focus in women's health. But at that time, I hadn't quite thought about infertility. And then toward probably the second half, towards the end of my training, I got pregnant with my son and gave birth to him. And so, of course, I used Chinese medicine throughout the whole process, during my pregnancy, to prepare for birth, during birth, postpartum, and then, to help my son and support his health and deal with various ailments that he's had to deal with. And so then that kind of opened up a passion for, I could relate to the whole experience of having a child, whereas beforehand that wasn't quite at the forefront of my thinking. And the idea of specializing in fertility kind of intimidated me. Then, but I still wasn't sure that was the path that I wanted to go. But then I graduated, and I kind of serendipitously was invited to join a busy, thriving practice that specialized in fertility. The owner and lead acupuncturist was going on maternity leave indefinitely with her second child. And so she needed to take somebody else on. And I just happened to call her the day that she said, I got to start looking for somebody. And so she invited me to join the practice. And like I said, it was a bit intimidating at first, but I was so blessed to be mentored by two practitioners that both had about 10 years of experience. And so I was able to hit the ground running. And within the first year, I was seeing up to 30 patients a day. And I just fell in love with treating infertility because it's incredibly rewarding, obviously, to help couples have babies. There's nothing more fun than your patient coming in just like over the moon to tell you that she got a positive pregnancy test, and you're like the first person that she's telling. That's pretty awesome. And but then also the patients are just so amazing. They're so committed, which is a treat in any, as I'm sure just it's you can only help somebody as much as they're willing to help themselves. And these patients are just so committed and so smart, such interesting women. And so it was a great practice. And it always kept me on my toes. It still always keeps me on my toes. There's always different. It's always evolving in some ways. I mean, Chinese medicine is what's beautiful about it. It's like, it's been around for thousands of years. So there are some things about it that never change, but certainly there's different environmental factors. There's just different things that about our modern times that affect the way that, you approach helping somebody restore their fertility and so forth. So that's the gist of it.
Mm-hmm. Okay, cool. And so it is like absolutely rewarding. I completely agree with you about helping women who are so wanting and yearning to have a baby and perhaps are having challenges in that area, to help them essentially create homeostasis in their body so that their body can just do what it normally naturally does, right? Which is conceive when given the opportunity. So it's about removing blockages in the body's ability to heal and have normal physiological function. And I think that's what I love about Chinese medicine and acupuncture, and how it's like so in alignment with chiropractic, because we're speaking of different types of blockages, whether it's nerve system blockage or chi blockage, but it's a blockage regardless that could be, like you mentioned, from environmental factors. It could be from emotional factors, so many different causes. And as practitioners, it's exciting to help a woman explore what her specific causes are, from the root cause perspective, and then help her create a shift in that area so that she can, get pregnant and have a healthy baby.
Yeah, absolutely. And I agree. Chiropractic and the Chinese medicine approach are really complementary to each other and kind of help each other have an even more significant effect on moving that energy and releasing blockages. And, I left out in the story of how I got into this and how my practice has evolved is that, now my practice is for the most part online, which people always say, how do you do acupuncture online? Well, Chinese medicine, acupuncture is just one tool in the toolbox of Chinese medicine. Most people, when they think of Chinese medicine, they think specifically of acupuncture, and they think of a Chinese medicine practitioner as an acupuncturist. But Chinese medicine is a whole system, and acupuncture is one of the tools. So that would be like seeing Western medicine as just, like surgery or something, that's one of the tools of Western medicine. And like you said, it's really rewarding to empower women with a certain knowledge for them to understand, like, oh, I see that there's this blockage, and I'm starting to connect the dots and like what is contributing to this blockage, so that they're able to take a part in restoring and maintaining their health and that homeostasis. Like you said, the body naturally, it wants to be pregnant. So if it's not able to fall pregnant, then it's not getting the support that it needs. And so that's how I ended up kind of bringing my practice online, because I wanted to not only help more women, besides just the limitation of my practice, but also because, it started when women were, in my practice, were like, well, what else can I do? What can I do at home? And honestly, it was just like, what you do in between the appointments with me is even more important than coming to the appointments. I'm here
That's correct.
keep you on track, but like, it's your life, it's your lifestyle. And a lot of people don't have the guidance that they need. And there's a lot of misguidance out there. It's not that they're not willing to, play a role in their health, but when they're Googling things, and there's a lot of fads out there that can actually make things worse. So I wanted to provide all of the tools of Chinese medicine and teach women what they can be doing at home on a daily basis to support their health and fertility.
I love that. Lifestyle is so huge. And, as practitioners, when we do see patients in office, it is just a small piece of their overall life, right? And so everything they're thinking, saying, doing, breathing, eating, is the lifestyle, that they're actively consciously choosing to live or not. And that's where the empowerment comes in. It's really showing people what you can do to take your health to the next level. So walk us through a little bit about your program online and how it works.
So when somebody signs up for my program, then they get access to a website that has a bunch of different instructional videos and then videos as well to explain, the purpose of the instructional videos and how to follow them. So basically, the core of the program, the foundation of it, are different acupressure protocols to do throughout their menstrual cycle, not just their menstrual cycle, their whole reproductive cycle, their period, and then leading up to ovulation, during ovulation, then the implantation, PMS part of their cycle. Because each phase of the cycle, so that's broken down into 4 phases, each of those 4 phases it needs to be supported in different ways. There's different goals in each phase. So for instance, after your period and before ovulation, you're rebuilding the uterine lining, you're maturing an egg, you want it to be healthy and ready for ovulation around day 14 plus or minus. And so that's a different goal to kind of help rebuild those resources than say during ovulation or during the implantation phase, where during ovulation it's more about a lot of action happening. The follicle is bursting, the fallopian tubes need to be open, you want the right fluids, you want fertilization to happen, you want a fertilized embryo to be able to travel down the tubes, you want the right hormonal balance and so forth. So there's different ways that you can support what's going on at each phase of the cycle. So that's pretty much how my program is organized, teaching the women how to support each phase of the cycle, because what I teach is that having a healthy cycle is basically the first step to getting your body ready because again, it wants to be pregnant. And a lot of women don't realize that their cycles might be really unhealthy, but still every month they're keeping their fingers crossed, like maybe this is the month that I get pregnant. And then just setting themselves up for disappointment, because it's kind of like wanting to pick fruit from a tree before, there's even leaves on the tree, or way before the fruit is ripe. So your cycle needs to be ripe before it's going to be able to, fall pregnant. And, and then when women understand this, then it's easier for them to play an active role in restoring a healthy cycle and getting their bodies ready. And they can see that they're on the road to pregnancy before expecting to get pregnancy. Like, oh, maybe I ovulated on time this month, or, I didn't have a short luteal phase, or I had a healthier period and so forth. So the program is organized around creating a healthy cycle and providing Chinese medicine-based tools to support that healthy cycle during each phase. So there's specific acupressure protocols that I designed in my clinical practice through my 10 years of practice. And so I teach women how to follow these protocols, like the instructional videos, they follow them step by step. And then there's also meditation and Qigong exercises. Qigong is like Chinese-based yoga. So the Qigong exercises are safe, and they also influence the energetic flow throughout the body so that you're getting flow to the reproductive organs and so forth. And then there's dietary recommendations, and it can also be used to support fertility treatment cycles as well.
Okay. So this is specifically for women who are actively trying to get pregnant, whether naturally or in addition to, like you mentioned, fertility, like an IVF or an IUI.
It is, although I have had women use it who just wanted to regulate their cycles, who weren't trying to get pregnant, and it's absolutely effective for that as well.
So women with dysmenorrhea, endometriosis, PCOS, having those types of irregular periods and symptoms, even if they're not actively trying to get pregnant, your program will still just help to create a normal, healthy menstrual cycle.
Exactly.
Right. And that is, what I'm finding is even in women that aren't actively trying to get pregnant, there's quite an epidemic of irregular menstrual cycles. And to the point where, so many millions of women are on birth control or recommended it, not necessarily even for the birth control purposes, but for quote unquote regulating their menstrual cycle. Right. And how that can actually be very detrimental and create more imbalance in the sex hormones, right? When we're taking synthetic estrogen and progesterone. So
Mm-hmm.
I think this is so important. And I even think back to myself personally in my 20s when I had a lot of irregular menstrual cycles. And, I was recommended a birth control pill. And when I was on it for 7 years of my life, my cramps were less. And in quote, I had what looked like an improved quality of life, right, compared to
Mm-hmm.
painful, heavy menstrual cycles and cramping. But when I was in chiropractic school, I was educated that this is really actually toxic to put in my body in the long term, right? And 7 years was a long time to put synthetic hormones in my body. And I started to learn about how it was depleting my body of B vitamins and how, there was all these other side effects that come along with being on the birth control pill. Once I had that awareness, I stopped taking it, but my heavy, painful periods came back. So it was just like, wow, I'm suppressing symptoms, but I'm not addressing root cause. And even though at that time I wasn't looking to get pregnant, like having support and solutions around having a healthy menstrual cycle and why that's important, even if you're not actively trying to get pregnant, this is a big thing. This is like a quality of life. I mean, I see women coming to my office that are just like, several days a month, they're really having pain and irritability and moodiness and all these symptoms that are almost considered normal with our periods that are not normal at all.
Mm-hmm. Yeah, absolutely. And it's in some ways, it's like the silver lining of having fertility issues because, a woman is really motivated to take action when she's not getting pregnant. But, and maybe a woman isn't as motivated if she doesn't have this like specific goal that she's not able to reach because her cycles are irregular and it's just convenient to maybe manage that with synthetic hormones. But it can, for one thing, those synthetic hormones will increase your risk factor for hormone related cancers in the short and long term. So it's definitely not something that should be taken lightly. And
Yeah.
it's in any woman's best interest to regulate your cycle because our cycles are really a marker of our overall health, and it'll also set us up for an easier transition during menopause, and like you said, just a better quality of life, short term and long term. And a lot of these things, if they go unaddressed, can lead to more chronic issues like autoimmune disease and systemic inflammatory conditions and autoimmune disease that can layer upon each other. You get one and then you're at risk for getting another one, and so on and so forth. So it's definitely a worthy cause to want to regulate your cycle and keep it healthy, and especially because every woman deserves that.
Yes. And that's actually what normal is. And I think culturally, at least in the US, we're so conditioned that it's normal to have painful cramps. It's normal to have clotting and heavy bleeding and irritability. And, because we see, commercials on TV like, oh, take this medicine and you can enjoy your period, so to speak. Right.
Yeah.
And then so it's like all about suppress with over the counter medication or birth control. And as opposed to really, like if you want clearer skin, take birth control, like all this stuff. It's just so crazy to me that this is kind of what we're really conditioned as women growing up and, even as teenagers, and that's when I think a lot of times girls even start the birth control. So, and I certainly as a teenager didn't have the wherewithal to like ask better questions and really do more research about side effects related to being on synthetic hormones for any period of time. So I just think it's something that I feel very passionate about getting out to women and letting them know that in my opinion, are better options for regulating our menstrual cycles and addressing other hormone imbalance related symptoms like skin breakouts and PMS symptoms. And like there's better ways to help manage that, and not just manage, but really resolve them, because we're addressing the root cause. That's really what it boils down to. So I'd love for you to spend a little bit of time speaking about how different emotions can impact our physical health, different organ systems, and specifically how that's related to overall women's health.
Yeah, absolutely. And preach, sister. I love everything you just said. Totally agree with it. And, this will be a good segue into speaking about emotions. But I just, like you were saying, that there's these commercials just encouraging women to, mask the symptoms of their cycles and the inconveniences of, cycle symptoms. And I, that just speaks to, I think, a larger, cultural issue of just, it's a lot, like that, when you even said repressing symptoms, and a lot of times the repressed symptoms are also a result of repressed emotions or repressed patterns. And emotions are inconvenient, and especially when you having emotions that are people don't want to hear about, or could maybe really be disruptive to somebody's life, because if they actually feel into those emotions, they may, want to create some big changes in their lives. And I think women, specifically are especially rather encouraged to, or taught to, repress anger, that anger is bad, that girls and women shouldn't be angry. We should always be smiling. If you're angry, and you express that, you're a bitch. And, we're conditioned from a young age. And so we, pretty much everybody experiences trauma at some point in their lives. And it might not even be that somebody did something traumatic to you. It might be just that, like, your mom, you were crying as a baby, and your mom somebody came to the door and she had to put you down and go answer the door, and you felt like abandoned in that moment. And so it's not that anybody did anything wrong, but most people have experienced some kind of trauma, of the variety of emotional, sexual, physical, psychological, mental, whatever combination. And even if you haven't experienced it firsthand, I think we vicariously experience it anytime we look at the news, and we, especially when you're hearing about sexual assault against women, and then, the perpetrators not getting the punishment, or, I don't know, politicians being elected despite the fact that they've assaulted women, and so forth. And that is traumatic to hear, because it's constantly, I think, instilling a sense of fear in women, or, lack of feeling valued. And we feel angry, but, we don't necessarily have like a place to actually voice that anger, and for it to be like respected and heard and empathized with. And so, this is for example. And so if this were then we're told, like, oh, you have these PMS symptoms, just mask them, just take this drug, and you won't feel them. So you also may not, express your authentic feelings, which could maybe upset some people, or maybe people don't want to hear them. And so I'm getting a little bit on maybe, soapbox about this, but I really think that there's a lot to it. And, so for instance, with like repressed anger, for example, that affects the liver energy from a Chinese medicine perspective. So there's a specific emotion that is connected to each organ system. So there's like the 5 major elements and 5 major organ systems. So for example, from a Chinese medicine perspective, the 5 elements are fire, earth, metal, water, wood. And so your heart, the heart organ system is considered the fire element. So if you think of maybe like passion and love, like we associate that with, fire, and we also associate that with the heart. So the liver, the emotion that's associated with the liver is anger. And from the Chinese medicine perspective, it's not a bad thing. There's no, like, anger serves a purpose, as does fear, as does grief. They all serve a purpose. But with emotions, the idea is to transform the emotion. It's energy. So it's going to pass through you and it's going to be transformed. So anger is a good thing because when we're angry about something that we see is like wrong, then it inspires us to want to create change for the better. It also helps us to set healthy boundaries. Fear obviously is going to get us to remove ourselves from a dangerous situation, and grief is going. That's where we really experience the preciousness of something that we held dear. So the idea is to transform that grief into preciousness. And we have to go through that process. We don't just get there. We have to feel those feelings and allow that energy to pass through us. But when the energy is repressed and we're resisting it, then it gets stuck and it can get lodged in our whole system, our whole being, our energetic being, as well as our physical being, and cause issues. So for one thing, the liver, for example, that system, pretty much any repressed emotion will affect your liver energy, because it's kind of like the filter of emotions. It's always going to be involved when it comes to processing any emotion, but specifically, anger affects the liver system. And from a Chinese medicine perspective, the liver, it plays a really significant role in balancing hormones and regulating the menstrual cycle. So if you have repressed anger, for example, that can disrupt the smooth flow of energy to your reproductive organs, as well as throughout your hormonal cycle. So, I'll see this a lot when I'm looking at basal body temperature charts, for example. And when I see the temperatures are really erratic and kind of zigzag, it's like, oh, it's liver, there's stress there. And stress it might be emotional stress. It could be not getting enough sleep or nutritional stress. There's a variety of stress, but the liver is being affected. And and also when you have like fibroids, endometriosis, a lot of this is partly, related to this irregular, choppy, kind of backed up energetic flow, as well as blood flow to the reproductive hormones and hormonal balance, so that you're having this, accumulation of unhealthy tissue growth. And that a lot of times, women with any kind of fertility issues or reproductive health issues, and there's a lot of like trauma that's happened, and women can be kind of cut off from different areas of their body, because it's hard to feel those feelings that might be trapped in those bodies, and they're so used to not being disassociated, because that was the response, the trauma response. And I think that's where Western medicine is a lot about masking, rather than actually getting to the root and feeling these feelings, because feeling feelings can really stir a lot of things up for the individual, as well as for a society at large.
Yeah. Exactly. And it's not easy. It's really challenging to process painful emotions and traumas that have occurred to, especially maybe from early childhood, that really could not be processed, let's say, as a child, but now as adults, they're still stuck in our body, right? And especially our nervous system. And it does us a disservice to not address them and release them and let them move through us. So yeah, these emotions can be current stuff going on, but it can also be really old stuff too that's stuck. And the more we can support ourselves in processing and feeling those emotions, I feel like it's just really beneficial for our overall health.
Oh, absolutely. It's true. It's like you said, it is really hard. It can be really hard to process them. It's definitely challenging and vulnerable. But it is so worth it. It's, just to feel freer in your life, let alone healthier and feeling emotionally lighter and so forth. And I think that most of the time there's a wisdom, your own innate wisdom and the wisdom of your body to also know how much you can handle at once. So it's not as though it's like you have to deal with it all,
Right.
like here's everything. It can be, it has its own process, and there's no rush. And even just tiny shifts can really open up a lot of energetic flow in your body. And the good news is that our spirits are resilient and our bodies are resilient. So you don't have to be perfect or have everything worked out or every emotion processed to restore your health. I think just a lot of it is just the intentionality behind, like, I'm willing to feel, and I'm willing to really look at what's maybe underneath this with some curiosity and some compassion.
Mm-hmm. And Heidi, I'm so happy that you pointed out that there is really an intuitive knowing of our body about what our capacity is and what we can manage and handle. We're never going to be given something that's more than we can handle. So whether it is a trauma or suppressed emotion that's coming forward, we can do it. We can manage it. We can process it, and it may feel overwhelming, but it is still something within our ability to handle and manage. And that's I think the beauty of innate intelligence, right? It's just beyond our comprehension, and we don't have to even think about it. It's just there. And a few episodes ago, I had Dr. Kelly Brogan on, and we had such an amazing conversation about especially women being prescribed psychiatric medications, sometimes even for something like PMDD, right? Where it's actually related to severe emotional, quote unquote, imbalance during the end of the menstrual cycle, right before they start their period. It's essentially, it's an antidepressant, right? That's prescribed to women for these severe hormonal imbalances that are creating these symptoms. And, how there's such an opportunity here to feel that pain and that trauma. But, it requires a lot of courage, because depending on how severe the trauma is, it can be a lot to have to go there. And she calls it the dark night of the soul, where when someone's weaning off psychiatric medication and really going to process and feel these really challenging traumas and emotions, it feels like you're at the very bottom, right? And that's actually what's required to then grow, move through, and get to the other side. And so I think recognizing that it's okay to feel bad. Sometimes it's actually quite normal. It's part of the human experience. And when we don't allow ourselves that time to feel these painful emotions, we're really depriving ourselves of that full human experience. We're really numbing ourselves. And it could be psychiatric medications. It also could be alcohol. It could be food, right? There's so many addictions that are out there that are all about suppressing emotional symptoms. But how beautiful it is to really fully feel alive and feel fully present in your body and your mind. And we can only do that without, these external substances.
Yeah, absolutely. You touched on so much great stuff there. And, it's also an avenue to come more fully into your power. Like going back to the Chinese medicine perspective and the idea of like the emotions serving their purpose and their opportunities for transformation. It's like the alchemy of the process. So when we're cutting ourselves off from that, which we're all going to do at some point, sometimes we can dive in and feel the emotions. And other times we're like, nope, Netflix binge. I just can't do it today. Whatever the numbing agent may be. But the times that we're able to go there and invite the process or go in partnership with the process, then we're also tapping into, although it's scary, it's like being a warrior. You're like, yes, I'm willing to go to that, into the dark night of the soul. But when you come through on the other end, you're that much, not just stronger, but I think more in touch with your soul, your spirit, and it
Yeah.
can open up so much in terms of your creativity or like your passion for life or like whole new experiences or people that you meet. It can provide a lot of shifting to tap into that like dormant fuel. So it's nice to
Mhm.
think of it that way, as opposed to just being like, like this repressed emotion is a cancer that's eating away at me and killing me. It's like, well, what about if I tap into this and I go through these feelings and I'm empowered by it and transformed by it.
Yeah. And with that work, you're going, like T said, like just you're going to have more meaning in your life. So it might mean that, okay, you know what, the job I'm at right now isn't fueling my purpose. So I'm going to make a choice to go somewhere else or start my own business, or the relationship I'm in is really not, you know, giving me meeting my needs, and I can now feel open to making changes, right? And not just settling, not just staying with what's comfortable, so to speak, but really questioning all the decisions we make in our life and how we can, and what do we deserve, and what is really in alignment with who we are authentically. And so all of this work, and I think I also just really, and I just had a little aha moment for myself about the use of pharmaceuticals, specifically birth control pill and antidepressants, for managing women's emotions, right? As women, we do tend to be more emotional than men, in general. And I think that culturally that was really unacceptable. Like that was just not okay. Like that was considered, like women were considered hysterical, right? When we think
Mm-hmm.
about that. And I feel personally very blessed to be a woman in 2019 in the US, where there is a Me Too movement. And even though we can say maybe that we're not completely equals yet as far as pay and leadership positions, there is such a freedom now that women, and with the power of the internet, are speaking out more and more. And that speaking out is the opportunity to process your emotions, right? It's sharing, it's
Mm-hmm.
connecting, it's saying, this is what happened to me. And other women being like, wow, I hear you, I empathize, I relate, and getting support from men. It's just really, I think it's so amazing. There's really no other time in history, I feel like, that this power of women's voice has been like just so powerful.
Yeah, it is awesome, and through that process of giving voice, whether it's publicly or even just to a friend or even just to your journal, it's not that everybody has or should or can, publicly speak out, but just the process too of affirming to yourself that you matter, that your experience is important, because there's so much shame around having experienced trauma of any kind, even, and it's not about, I think a lot of people kind of invalidate their own trauma because they say, well, maybe this happened to me. I mean, people who've even been severely abused don't even recognize that they were necessarily abused. And a lot of times we have this tendency to kind of dismiss it like, well, no, it's not as bad as like so-and-so, they were really abused. And so I don't even have a right to like acknowledge my abuse. And it really is not about comparing ourselves to, it's irrelevant what somebody else went through in terms of comparing it to, what affected you. If you were affected emotionally, that's that you were affected emotionally. And emotions are, I consider it one of the, like a sixth sense, another sense that we're experiencing the world and using that information to guide our choices. So like sight and smell, emotions are there to guide us. And so when you're affected by something emotionally and that's trapped, that's all that matters. It's not like rating how severe your trauma was. It's just, and so by feeling a lot of shame around even having those feelings, or, especially if you were shamed by somebody, and in a sense, I feel like saying, oh, here, take Motrin to cover up your PMS because you should be ashamed of that. Like that's a kind of a message that like you shouldn't feel these feelings. And especially if it's like, oh, you've got bad PMS, well, you're crazy and we need to give you Not to say that people with psychiatric disorders are crazy, but, considering it like you have a psychiatric disorder, you're mentally unhealthy to feel what
Right.
you're feeling. So there's so much shame around feeling anything, especially when it's
Yes.
fear, grief, or sadness, because those are uncomfortable feelings. They can be very difficult feelings to move through. They're heavier, but there's no judgment there. It doesn't make them bad or wrong. And so by allowing ourselves the space to process these feelings and feel these feelings, we're also telling ourselves that we're worth it, and sometimes can be really like, I like to journal, and sometimes I'll just, when I'm feeling overwhelmed emotionally, because I definitely fall into the mental story of like, well, you shouldn't feel this way, and shaming myself. Then I have this practice where, I'm like my adult self, and I'll talk to my inner child, and I'll say like, oh, like, what's in your heart today, to my inner child. And I just let her say it. Like, I see it as like, oh, she's a child, like, let her just say whatever. And then she can be like, have the pity party and just be like, it's not fair, and blah, 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 blah. And by kind of disassociating with it, I'm not like judging myself for having these feelings. And then when she's gotten it all out, then my adult self like validates everything. Oh yeah, I can understand why you would feel that way, and it's okay for you to feel that way. And I see how wonderful you are. And so, since I've been practicing that, it's like, I feel like I've come more fully, like I feel that more of a grounded sense of self-worth and self-love, because I'm allowing that space for myself to feel these feelings, and that has a ripple effect in my life. I'm more self-aware, and I'm making decisions for myself that are more based in this, like, I'll be okay because I know how to support myself through it, versus an unconscious reaction to maybe a situation where I'm acting from a place of like, well, I don't want to experience pain, because I'm afraid I can't handle it. And it's like the inner child, like, no, resisting that. So, I can't remember exactly why I went off on this tangent, but just, I think, just you were talking about the Me Too movement and just the power of validating your feelings.
The power of validation. And I appreciate that you're mentioned that validation can come in so many different ways depending on the needs of that individual woman. It may not have to be anything completely public, but it is, I think, just really maybe speaking it out loud, and that could be through a journal, right? It just writing it down. But there is something, I think, with connecting with women and sharing your story, and whether it's just with a close girlfriend, or it is on a Facebook page, or it's in a larger forum, whatever that may look like for you. But connection, I think that's something that as women especially, we really need and crave in our lives, that community of other women that get us, that see us for who we are, and love us despite despite the shame we may feel, or the flaws that we may feel about ourselves. So that's one thing that I know has come up a lot for me in the past few years, and I'm hearing that from a lot of other women too, especially during the interviews I'm doing, of just like, how can we connect? And I think that's why also in general, like online programs like the one you've created is so powerful, because part of it is the education, right? And the information and the empowerment that comes from that. But I'm also sure that the women that are in your program are just so grateful to connect with other women that are going through something similar.
Oh yeah, absolutely. I mean, I couldn't agree more. The connection is so healing and transformative in and of itself. And, it's so easy to feel isolated and feel like you're, just so alone in your feelings, especially when you're spiraling out. So it's just like so comforting and reassuring and validating just to know, like, oh, I'm not crazy, somebody else understands it, and they felt this way before too, and they still love me, and I love them, and just, and again, validating that you are worth it. You're worthy of love and acceptance, and having other women that are willing to hold that space for you to be messy and be vulnerable and still love you, and that be returned, it going both ways, and just to facilitate that kind of connection and belonging, and like you are as well through your podcast. And definitely when it comes to fertility, it's especially isolating, because a lot of times women can't go to the other women in their lives that they would normally go to for support, like maybe their sister or their best friend or their mom, depending, because maybe their sisters had no problem getting pregnant, and that's, and maybe is pregnant now and it's really triggering, or their best friend, or maybe their mom, is just not able to really understand and hold that space for a woman going through the fertility issues in a way that's helpful. So that can be really difficult. Plus there's kind of, a taboo around it. It's very private, like having a miscarriage, for example, it's like, can be so devastating and physically difficult. And, a woman has to make up a lie about why she can't come to work, because she's not comfortable saying, she's having a miscarriage or recovering from a miscarriage. So it can be an incredibly isolating experience. And so, yeah, it is really important to have some community support.
Mm-hmm. Totally. I always thought, the whole miscarriage shame that you're speaking to was always extremely sad to me, because even kind of just culturally, how a lot of women in the US wait until 12 weeks to share with anyone that they're pregnant, in fear of, in case this baby doesn't make it 12 weeks, right? I don't want to have to then talk about why I'm not pregnant anymore,
Mm-hmm.
And I just find that very sad, that is definitely alive and real.
Yeah, and so many women have experienced miscarriage in their
Right.
life, so it's disproportionately kept secret for how many people experience it.
Right. And I think for me, the way I look at it is, if you are wanting to be pregnant and then have experienced a miscarriage, and you're now experiencing grief and possibly shame, right?
Mm-hmm.
And other emotions, and anger, and all these other emotions that are coming up. Now would be such a good time to have support from your closest friends and family, to help you go through this challenging, emotionally and physically challenging time. But if you've kept it a secret, then how are your friends and family supposed to be able to support you?
Mm-hmm. Yeah. Yeah, and I mean, it can be challenging too, because a lot of times people have the best of intentions and want to support you, but don't necessarily know how to do it in a way that truly feels supportive, because they can
Yeah.
say things that are not actually sensitive, and obviously not intentionally, but that's what's so tricky too about the infertility journey, is that, and if you haven't gone through it yourself, or you're not like a healthcare practitioner who helps this population and is very familiar with it, and you can be pretty unaware of what does not feel supportive, even if you have the most loving intention. So a lot of times women are just like, no, it's just easier to not, to just keep it to myself.
Mm-hmm. Right. Well, Heidi, we have to wrap up this episode. Do you have any last closing thoughts you'd like to share with the audience?
Let's see. Just, I think it's awesome that you have this podcast and that you're facilitating, like you said, this, connection for women, and, for your listeners who, on the note of just seeking out community and support, that, it's wonderful that we are opening up this communication so that people can be more aware of how to be supportive of each other as women, not just when it comes to fertility or miscarriage, but all of women's health issues. Make them not so taboo to talk about, and have the courage to be vulnerable with each other, and hold space, and know that holding support oftentimes is just really listening. We don't have to say anything. There's oftentimes no like magic words that are going to make everything better, but just allowing each other to have our feelings and share our experience, and hold that loving space for them. So thank
Mm-hmm.
you. And I'm really happy to be a part of this.
Wonderful. I love that closing thought. Well, thanks again for coming on the show today.
Thank you so much for having me, Laura.